The next question here is, students were asked to talk about bone tumors and tumor-like lesions under the following headings: general features and pathogenesis. Okay, so you could have a lot of bone tumors. This one is just like a general heading. You are just to talk about a group of things in general. Do you understand? So talk about bone tumors and tumor-like lesions under the following headings: general features and pathogenesis. Okay, so I have all the pictures right here before my screen, which I'll upload it later, you guys will see. So we'll start with the pathogenesis. Okay, we'll start with the pathogenesis. So bone tumors usually arise from mesenchymal cells that are capable of what? Forming other cells, like osteoblasts that get to form bones, chondroblasts that get to form cartilage, fibroblasts. Okay, so they arise from the parent cells. Okay, so their development involves genetic mutations and translocation. Like, for example, you have the RB gene and the TP53 gene mutations in osteosarcoma, the EWSR1 translocation in Ewing sarcoma, then IDH1 mutations in chondrosarcoma. This one, you're just trying to list the examples, okay, as an intelligent student and all. Okay, sometimes they could come in because we're not trying to talk about possible things that could actually bring, the bone tumors. So it could be disorder signaling pathways, okay, like the catenin pathways disorders, the hedgehog pathways disorders. Then it could also be environmental or acquired factors, like you're having bone tumors because you were exposed to some radiations or due to some calcium deficiency, all those Paget's disease stuff. Okay, so cells of origin is tumors that could originate from osteoblasts. Example, we have things like osteoid osteoma, osteosarcoma. Tumors that could originate from chondroblasts include things like chondroblastoma, chondrosarcoma. Then tumors that could originate from fibroblasts include things like fibrosarcoma of the bone. Okay, so what are the tumor-like lesions? Okay, they are non-neoplastic, but they look like tumors. Do you understand? They mimic tumors radiologically. So pathogenesis often involves developmental anomalies or reactive process, okay, rather than a true neoplasia. Okay, so let's quickly move. Let me move to the next page. Now, what are the general features? General features is bone tumors are rare, okay, compared to soft tissue tumors that we earlier on spoke about. Their benign ones are more common than malignant ones. So in benign ones, we have things like osteochondroma, echochondroma. Malignant ones, that's when you have things like osteosarcoma, Ewing sarcoma, chondrosarcoma. So anytime you hear sarcoma, it's actually malignant. Oma, okay, that's like chondroma or so. Okay, so all those chondroma, okay, is basically benign. So clinical presentation, somebody having these bone tumors will feel a lot of pain. Okay, there's swelling of mass, then systemic symptoms sometimes if the cancer is actually spreading to other parts of the body. Radiological features is benign ones, you see them in one place, they are circumscribed. Okay, malignant ones, you can't really spot their boundaries. That's to tell you that they're already spreading to other places. So that's just what we have. Then for biological behavior, benign ones are slow growing, okay, they don't spread to other places, while the malignant ones, they grow so fast, they are aggressive, they can actually spread to other places. And one of the complications is they can spread to the lungs, causing complications in the respiratory system. Now this is